Thank you everybody for joining our second webinar, and the topic is integrating vet telemedicine. So it's the second of three. The last one was an intro to telemedicine. So for those of you who didn't attend the first one, I'll give a quick overview of what Pawzy is and what we do. So Pawzy connects pet parents to healthcare services and advice, and we recently launched a telehealth tool that allows clinics to practice telemedicine with their own patients. So it's a software tool. We're also launching next week a direct-to-consumer service. So any pet parent in Ontario will be able to book appointments with an Ontario licensed vet. And we are looking for vets to still join the platform. So if you're interested, please let me know. So my background is in technology. I was part of the founding team of a company called RateHub, which is Canada's leading personal finance marketplace, and built it to 6 million annual users as the CMO. Our pet health advisor is Dr. Walt Ingwerson, who is past president of the World Small Animal Association. He was former president of the OVMA and is a very active member of the vet community in both Canada and the US. And then our technical advisor is Stuart, who is the former CTO at Expedia and Realtor.com. He's based out of Seattle. Just wanted to give a quick recap of our first webinar in case you did not have the chance to attend. So you can actually watch the recording of the last webinar on our YouTube channel. So if you go to the link listed here, you can watch the first one. We also conducted some polls during the first webinar, and we'll do a couple polls in this webinar as well throughout. So we have 3 polls, and they are anonymous, and you can you can participate during the session, and I'll share results as they come in. But these are the results from the first couple polls that we did last time. The first question we asked was the impact of COVID-19 on revenue. And as you can see, nearly 70% of vets reported that revenue in April 2020 is lower than April 2019. And then around 20% the same, and then less, 6% for both higher and not having any basis to compare revenue. We also asked the attendees if telemedicine has can improve patient outcomes. And oh, by the way, I forgot to mention, you can ask questions in the chat channel, and you can ask them throughout the presentation, and my colleague Nicole's actually going to keep track of all the questions, and we'll answer any questions at the end. So feel free to participate and to chat in the chat channel. So yeah, the second question we asked in the poll is, oh, sorry. Whoa, gone ahead of myself here. The second question we asked was about telemedicine and patient outcomes, and if telemedicine, in their opinion, they felt could improve patient outcomes. So nearly 70% of attendees agreed that it could indeed improve patient outcomes. 5% thought it could worsen, and then around 25% are undecided. And then this is telemedicine use before during and after COVID-19. So what percentage of people have been practicing before, during, and after? And as you can see, over 80% of the attendees had adopted telemedicine during COVID-19. 30%, I was surprised, were practicing before, and then over 50% plan to practice after. So the agenda for today that we'll be going through are first going to talk about the components of virtual care and how to adopt a virtual care strategy. Then we'll go through technical requirements, your EMR integration or practice management software integration, go through booking appointments, touch on telemedicine software, collecting payments, and then again at the end we'll do a Q&A. So one thing I wanted to share to set some context off the bat is a survey that was conducted by the Canadian Medical Association. And we don't have, I couldn't find similar data for vet health, although I think it would be really interesting. But I do think that, you know, we do look at human health as very similar to pet health, and trends that are happening on the human health side often trickle down to pet health. So I think this is really interesting context. So this survey was taken in 2018 prior to COVID happening. And the data is really interesting. So 71% of Canadians would like to be able to book appointments online, but less than 10% of family physicians offer this. 63% of Canadians would like to be able to email their healthcare provider, but just under 25% offer this service. And then just over 40% would like to have video visits with their healthcare provider, but just 4% of physicians offer this option. It would be interesting to see how these numbers would change after COVID, but it's as you can see, the demand for virtual care options existed before COVID even hit. So one can assume that these numbers would only be higher right now. This is also supported by Google Trends. So at Pawzy, we're always monitoring what people are searching for online. And as you can see, the interest in telehealth has increased over 570% over the same period last year. So a lot of it is around general searches, but online vet and vet telemedicine searches have gone up by 83%. So interest has definitely gone up. Now, what are the components of virtual care when we reference this term? Really, we're talking about any online virtual interaction that you have between a patient and healthcare provider. So starting with the website and what self-serve resources you have on your website. So whether that be blog, educational content, more information about your practice and the services you offer, etc. The next component being online booking. Do you offer online booking through your website? Then electronic messaging. Do you conduct services over email or SMS? Do you collect payments online? Do your patients have access to medical records online? So can they log in and view their pet's patient history? And then finally, virtual visits. Do you offer telemedicine as part of your practice? So right now, the traditional way that the interaction between patient and provider works is that the clinic visit is done first. So you book an appointment, you call the office, you book an appointment, and you go in to talk about whatever problem or preventative care you're seeking. The virtual first strategy flips things around. So the clinic visit is the last step as opposed to the first step. So when you come as a patient, you'd come to the website first and try to triage things as much as you can with educational resources, viewing electronic medical records, more proactive management of patient care. So if you have access to the medical records online, you can see, you know, where the vaccines, if vaccines are up to date, when you last did your annual exam, etc. Then you can book an appointment online, and you can fill out an intake form and actually collect a deposit on booking an appointment. So the intake form, you might have a record of the pets already, but you can update information, or if it's a new patient, you can collect the necessary information that you'll need to establish that VCPR. Then the patient can book a virtual visit. So this happens before the clinic visit and works in the cases of symptoms triage, so assessing new or worsening symptoms. If patients are seeking general advice, such as behavioral or nutritional advice, and then medication scripts, so flea and tick, or you know, renewals on pre-existing conditions. A lot of these things can be done online. And then a clinic visit is used for things that only need to be done physically in person. So anytime where you need a physical examination of the animal that can't be done from a visual inspection virtually, any lab testing, and then any procedures or vaccines. So it kind of flips things around to what the current strategy is, and it does require a sort of renewed, a new approach on how you set up your clinic processes. And we've seen this happen on the human side, where a lot of, during COVID, where a lot of human health services have had to go virtual first because they don't want to risk they don't want to risk people coming in with symptoms, and they want to be able to triage people first before accepting them to in clinic. So one example is my family physician, which is part of the Magenta Health Network, which has 3 clinics in Toronto. When COVID hit, they actually immediately canceled all of their appointments that they had scheduled, and people had to rebook virtually. And every appointment first goes virtual before they do any in-clinic care. So they really went all in and completely changed their clinic process. So it's that sort of flip in thinking that will be required if you want to adopt a virtual first strategy. So beyond this, like, what does the future of virtual care look like? You know, those are the components that we discussed before, are things that are right now in the market and at some level of adoption. But what does the future look like? So some of the things that are being developed in the vet health field are things like chatbots, where you can use artificial intelligence to triage symptoms. So you know, my dog has diarrhea, and then you talk to a chatbot and they ask you a couple other questions, and you sort of go through the assessment process of the potential causes of what the diarrhea is, and it's obviously not foolproof and doesn't replace a human, but it can help. It can complement rather than replace the human interaction between patients and providers. The next thing is our health monitoring app. So you can do things like track your vaccines, your surgeries, all those things, but also track symptoms. So sometimes it's hard to remember or keep track of when certain symptoms started or when they got worse. And a health monitoring app allows people to accurately track symptoms and also improvements in health. And then finally, and this is one that I'm very excited about personally, are integrated software applications. So right now, there are a lot of different vet software options, but they don't really speak to each other. So your practice management software doesn't integrate with telemedicine solutions, for example, or online calendar management solutions. And that's because the software has been built in a way that's a closed software system, where we're starting to see, and I hope that we see more of these integrated software applications. So you can your practice management software can speak to some of these other apps and email marketing software and all these different opportunities that you can integrate with. And the reality is that your practice management software is not going to service all of your needs for your entire business. And the sooner that the practice management software companies realize this and start to develop in a way that has the open software mentality, the more that they will succeed in the long term. So what's the business case for telehealth specifically? In general, telehealth can help you improve patient outcomes. So complement your existing practice rather than replace. You can also attract more high-value millennial pet parents. So millennial pet parents are the largest pet-owning demographic now, and they also are the most valuable segment of the market. So they're more willing to spend more money and are more likely to be higher value clients for your practice. So being able to adopt technology and efficiencies and stuff that attract this high value segment is good for your business. Telehealth can also help you better monetize advice requests and follow-ups. So right now, or in the past at least, the vets have been conducting a lot of free advice and been giving a lot of free advice through the phone or through emails and on checkups, etc. And telehealth actually gives you an opportunity to monetize this time and assign a value to the time that you contribute to this, especially now that with the pandemic happenings, there's so many more questions and people are trying to avoid coming into the clinic as much as possible, and they don't want to run the risk of spreading a possible infection. So being able to better monetize this time that you are spending answering all these queries is I think a welcome opportunity for vets. Telehealth can also help you save money through lower fixed costs and admin. So the fact that you don't actually need a physical exam room to conduct virtual appointments is something that's really interesting. And then also on the admin side, if you have telemedicine software that has calendar scheduling or payment processing integrations, this can save you a lot of time on the admin side. You can also support a remote workforce. So as we've seen from COVID happening, a lot of work can be done remotely, and I think that there are going to be long-term implications on the modern workforce, and a lot more people are going to want to work remotely. following this. So right now it's forced, but what are the long-term implications of supporting a workforce that wants to do more work from home, more remote work? And then finally, we've been forced into a situation here with COVID-19 where we have to respect social distancing measures, and telehealth can help us do that. So the rest of the presentation is quite technical and very actionable. So again, ask any questions that you have in the channel, and I'm happy to answer them and review any questions or clear up anything at the end of the presentation. So if you're setting up telehealth, the three most important things that you need to have to run this successfully from the technical side are: one, you have to have the appropriate hardware. So do you have devices that support telehealth? Do you have a working laptop, a desktop, or even a mobile phone? And if you do have these items, but they don't have good video and audio functionality, maybe they're a little bit old or they just don't offer the quality that you want, then how can I supplement our existing equipment with external video and audio? And I'm actually going to go through each of one of these in more detail. The second thing you need is software. And with software, you have two buckets of options. You can conduct telemedicine through general teleconference software solutions. So the most popular ones being Zoom, Google Hangouts, FaceTime, GoToMeeting, WebEx. Those are the most popular ones that are general teleconference solutions. And then, or do you want to go for something that is more of a telemedicine software? And I'll go through what the differences are in those two, but telemedicine is specific to the medical field and offers more functionality related to managing the patient relationship. And then finally, and I can't stress this enough, it's really important that you have really good internet. So especially right now where a lot of people are using teleconference technology and also streaming Netflix and different streaming services at record rates because we're all home right now. And it's really important to have good internet. There's been lots of problems with people's internet connections and, you know, slower speeds and outages and everything because the networks are stressed right now. So how can you invest in internet that will be reliable and fast? So in terms of video and audio, if you have devices that you would like to, like, a computer or phone or tablet that you'd like to upgrade with webcam or a headset, these are different options. So the best thing you can do is connect via a USB port because most laptops, computers have USB ports, and I think that's the safest way to go. So on the webcam side, you're looking for something, there's premium and budget options. You're looking for something that obviously has HD video. All webcams that you can buy today have HD video. It's also useful to be able to take picture snapshots, so instant pictures of your patients for your medical records. And then a lot of webcams actually have built-in mics, so this can take care of both the video and the audio aspect. And so I've recommended a couple here. And then on the premium side, you get things like a wide angle lens, autofocus. So like if you're moving around a lot, it'll automatically focus for you. And then it can also help with lighting. So the one that's recommended here actually has a built-in ring light. So you can look like a YouTube influencer while you're giving health advice. So the price range on the webcam are anything from $40 to $145, so it's not crazy. And then we've recommended two for you here, like one on the lower end and one on the higher end. I'm going to be sharing this presentation after, and you can actually link to, I've included links to where you can actually buy these cameras. Given the popularity right now of teleconferencing, it's actually hard to locate webcams and headsets that are in stock. And like Staples, for example, is sold out of webcams and headsets, or they were the last time I looked. And so I found that there was good options available on the Grand and Toy website, actually, which I don't think I've visited a Grand and Toy since I was a kid. So it's nice to know that they're still around, and they do have inventory of webcams and headsets. And then the other one is Amazon. Is the other place that seem to have inventory. So on the headset side, you can actually get an external microphone that you can plug into your computer. However, I do recommend headsets over microphones because you have with a headset, you block out the external audio. And you can get really good headsets these days. It's really not necessary just to have a standalone microphone. You can get away with a good headset. I'm using this one that I've listed here, the MPOW USB headset for $35, and it works great. And I've been using it a ton. So on the headset side, you're looking at $35 to $120. You want something with a built-in mic, and you have things like volume control. I don't know if you can still see my video, but I have I have an attachment on the wire here where I can control volume, and I also have a mute function. And then on the premium side, you can actually do wireless, so and have better sound quality. So these are two options, again, available on Amazon or Grand and Toy website. So looking at telemedicine software or teleconference software, what is the difference between teleconference and telemedicine software? So actually going to use Pawzy and our software option and Zoom as a comparison, because they both pretty accurately represent the general functionality of the options available. So Pawzy being a telemedicine specific conferencing software, and Zoom being a general conferencing software. So the first thing is, do you need to download an app? So with Zoom and with GoToMeeting and WebEx, you do have to download an app, which can cause some delay sometimes in providing patient care, because if your patient has to first download an app before joining a call, it can add confusion or time onto the call that might not be necessary. Pawzy and other solutions are some other telemedicine solutions are web-based, so you just have to use your device browser to log in, and you don't have to download anything. So that makes it a lot easier. The functionality of, the basic functionality of teleconference software, offering video and audio, instant message, you can screen share similar to what I'm doing right now through Zoom. You can transfer files, and you can also have multiple participants. So let's say you want to have another vet from your office or a vet tech join, you can do that. Where telemedicine software really differs is in a couple areas. The first being the patient queue management. So with telemedicine software, you'll have a virtual waiting room where you have a welcome message, and which you can customize, and you can actually see the different patients who are logged in. So you can, if you're running late, you can send messages to the other patients who are on the queue. You can see if they're running late. It just is a good way to manage a queue, similar to how you would manage a waiting room in an actual clinic. You also have things like instant photo capture, which allows you to take photos for your medical records. Telemedicine software often has payment integrations, so can you collect payments before or after the call? And then the other big thing is the security and privacy element. So I don't know if you've been following the news on Zoom, but there have been issues with security with Zoom, and people being able to log into private meeting rooms, and also and they also don't have the most secure servers or end-to-end data encryption. So on the health, if you're using a telemedicine software, these have been developed under very strict healthcare regulations. So in the States, HIPAA, and in Canada, PIPA, which regulate human healthcare. So if privacy and security is something that is important to your practice, then you definitely want to look at telemedicine software versus just regular teleconference software. And hardware and internet tests are very important to conduct prior to launching your telehealth service, but also before every call. It doesn't add a lot of extra time to do tests. So you want to, keep on top of these things as much as you can, especially given all of the problems that we're seeing with internet. So if you want to do a video and audio test, so most telemedicine software are built on something called WebRTC. So most of the different software options that you'll see are actually built on this one framework, and you can test it out using this link. And what it'll do is it will test your video and audio capability. So is your microphone working? Is your camera working? And it will automatically test it. It takes like 10 seconds. So, being able to do it before every call it's not onerous. The other thing is internet. So as I mentioned, internet is super important, especially because web conference software, there's two elements that are important with web conferencing. So download speed, but upload speed is very important, because you have to be able to not only receive data and receive people's, audio and visual that are communicating to you, but you have to be able to communicate back and to send your audio and visual back to people. So upload speed is super important. And where you see a big discrepancy in different internet providers is often on the upload speed. So we actually switched our home internet from Rogers Ignite to Bell Fibe because the upload speed with Rogers was a problem. So I highly recommend fiber internet if you are if you have the capability to do fiber internet in your area. It is the best option that's available to you. And based on my experience and also doing a lot of research online, Bell Fiber internet is better than Rogers Ignite in a lot of areas. So you might want to consider switching if you've been having problems. I'm actually going to use this time right now to conduct our first poll. I'm going to launch it now. So the first question that we have, and again, this is anonymous, and I will share the results after people start voting. And the question is, does your vet practice currently offer any of the following virtual care services? Please check all that apply. And it's multiple choice, so you check off as many as are relevant to you. So the options are an informational website, online appointment booking. Do you conduct some of your services through email? Do you have online payment processing, access to online medical records? Do you have virtual visit and telemedicine capability, or none of the above? So 6 people have voted so far. Oops, I have to go back there. Okay, I think that's probably it who are going to vote. No new votes seem to be coming in. So I'm going to end the poll and I'm going to share the results. So as you can see, most people have an informational website. Only one person out of the people polled have online appointment booking. Most offer email service. Around half have payment processing. Only one person has online medical records. 2 out of 6 offer virtual visits and telemedicine, and then one person had none of the above. Obviously, this is a small sample size, but it does show you that there's a lot of opportunity to adopt more virtual care services. Okay. I'm going to exit out of that. Okay. And we'll continue on. Okay. So there's a lot of questions around, does telemedicine software integrate with our EMR or our practice management software? The short answer is no. Because most of the EMR software has been built in a closed environment, in that it doesn't integrate easily with other software, then you actually have to use both in conjunction with each other, and more think of it as a side-by-side relationship and a complementary relationship as opposed to like an integrated relationship. So in practice, what does this look like? If you're running your EMR, so let's say you have your computer and you're running your practice management software, you have it up, and you want to make sure that you're keeping track of everything in your EMR software while you're doing telemedicine consultation. So the way that you can do this is through just having multiple browsers open. So you have one tab open which has your practice management software, and then the other tab is running the telehealth software. If you want to be able to view both at the same time, then you might want to invest in a second monitor. You can get a really good second monitor on Amazon for like $150. And then you can view both at the same time. I think it's a good investment to have a second monitor anyway, so I definitely recommend that. And as I said, you can get a decent one on Amazon for $150 and delivered in 2 days. So it shouldn't be onerous to be able to have that. The other option is that if your telehealth software is mobile friendly, which most are, then you can actually have your practice management software up on your computer and then run your telehealth software on your phone or tablet. And you can even get a tripod for your phone or tablet so that it has a stand to sit on while you're talking. So you can, they have these simple clip-on phone stands that you can add to your phone, but there's also tripods that you can buy very cheaply on Amazon too. So you don't even need to invest in a dual monitor if you don't want to and you don't see other uses. You can actually just use your phone and your computer. When we're thinking about how you integrate telehealth software as part of your existing appointment booking flow, the first question you need to ask is, do you currently offer online appointment bookings? If you do already have the capability for online appointment bookings, telehealth software is a simpler integration. If you do not have the capability for online appointment bookings, and most vets do not, because most vets are using server-based practice management software for calendar management. So Cornerstone, what's the other big one? I'm blanking right now, but they're not cloud-based, and therefore they don't actually offer online appointment booking. So then you need to look at software solutions that offer, if you don't have appointment bookings, you need to look at software solutions that have these three things integrated, which is appointment booking software, telemedicine or teleconference solution, and then also payment processing. So let's first start with, if you do have the capability currently of online appointment bookings, then you only need a software that has virtual conferencing capability and then payment processing. So we've integrated, for example, one of our clients is using EasyVet, which is a cloud-based practice management software. And what we did is we created a new appointment type and added the link to the virtual waiting room within the practice management software, and then everything was just easily integrated. So it's all one solution. It's super simple, and you can collect payments easily through the software as well. So this is a very easy integration. If you already have the online appointment booking software capability, then you're already in a really good spot, and you don't need to invest in a whole separate add on to your website and all that. You've got the option to integrate quite simply with a solution. If you currently do not have appointment booking software, then you might want to look at a more integrated solution, such as SmartVet. So SmartVet has the appointment booking capability. They have telemedicine, the software capability, and they also have payment processing. So these aren't the only two options, and you can use Pawzy and adopt a separate appointment booking software. There's also industry agnostic options as well. So it's not actually necessary to use a specific telemedicine software, as we discussed earlier. And you might want to look at general solutions, because in general, a lot of industry agnostic solutions do have more functionality than ones that are specific to industry. The difference being with telemedicine is that these industry agnostic solutions don't integrate with the secure telemedicine software. So it's not going to be like HIPAA compliant, which you are not actually forced to adopt as a vet. It's only regulated for human health. However, some vets have opted to adopt human health privacy and security measures. But if you're looking at industry agnostic options, these are the two options that I would recommend for booking management, teleconference, and payment processing. So one is more robust, and it's called simplybook.me, and then the other one is Calendly. So I won't go through each of the different options that they offer, but as you can see, simplybook.me is a little bit more robust, and they have a little bit more marketing features. So like things like coupons and gift codes, a cancellation policy. They also have the HIPAA intake form option, which is more compliant, but they all offer the calendar management. It can be a link on your website. You can manage multiple providers, you can process payments, and they integrate with Google and Outlook calendars as well as teleconference solutions. So both SimplyBook and Calendly have integrations with Zoom and GoToMeeting, and I'm not sure about WebEx, but I know that they have integrations with those too. And so you have options out there, and what you really need to do is evaluate what solution works best for your business as it stands right now. And if you need a little bit more hand-holding in terms of adopting virtual care solutions, then you might want to work with a vet-specific software solution, because they understand your business. They, you know, we know your business very well and what your pain points are, and we also prioritize patient care as the number one thing, as you do with your practice. And so, you know, if you're looking for that sort of hand-holding experience, then you might want to look at a vet-specific software. And that's all I have in terms of scheduled content. If you have any questions, I'm happy to answer them now.